I want to talk now a little bit about nursing homes as well as hospitalization in general. We're pleased with the continuing decreasing trends we're seeing among COVID hospitalization in Ohio. Fewer and fewer Ohioans are in our hospitals because of COVID. Trend is particularly hopeful when we look at the numbers for those who are 80 and older. In December, those 80 and older made up more than 25% of our COVID hospitalizations. This month, that number has dropped to about 18% of our COVID hospitalizations. But even more important than that is that the total COVID hospitalizations have gone down. So not only are nursing homes a smaller percentage of the whole, but the whole is much, much, much smaller. So if we look at our data here, this is the number of Ohioans who are in our hospitals because of COVID. You'll see it continues to drop. And again, we knew, or we felt that once we started vaccinating nursing homes, vaccinating those who are older, we would see a dramatic decrease in the number of people going into our hospitals, and that is what we have seen. So again, down to 1,262. That number continues, most days continues to drop, and we're very happy with that. We're also seeing a decline in COVID cases among nursing home residents. In mid-December, we had about 5,100 nursing home residents who had COVID in a given week. So that would be a snapshot for 1 week, about 5,100 1 week in December. Last week, a snapshot, number of nursing home residents with COVID was down to about 1,000. Another way to look at this, we had in 1 week in December, we had 2,832 new cases in that week. Last week, we had 369 new cases. So we've gone from 2,832 to 369. And obviously, we're not satisfied yet. We want to continue to drive those numbers down. As of last week, we've given over almost 91,000 of our nursing home and assisted living residents the first shot, and 70,000 of those have already completed the vaccination process. They've gotten their second shot as well. Now, as part of our commitment to protecting those in our nursing homes, we also announced the COVID-19 vaccine maintenance program, basically to continue as people go in nursing homes, new residents come in, continuing to vaccinate them and make that vaccine available to nursing homes. Same thing would be true with a resident or a staff member who has changed their mind, who didn't want it before, now wants it. We want to be able to provide that to them, and we will provide that to them. We also have new hires, new people who have been hired or coming into nursing homes. We want to afford them that opportunity. So this program has now started, and some of the first vaccinations are occurring this week. So that program will ramp up, and we're happy that this is moving forward.